Let's start with a simple question. What's the mammary gland actually for? Its main job is to produce and secrete milk to nourish an infant, but there's a lot more going on under the surface. The mammary gland is a specialized organ located on the anterior chest wall on both sides. It's made up of three main parts: the skin, the parenchyma, and the stroma. Let's look at the skin first. It includes the nipple and the areola. The nipple is like a cone-shaped structure, sitting at the fourth intercostal space. The areola surrounds the nipple and has a darker pigment, usually pinkish brown. Inside the areola are little bumps. Those are tubercles of Montgomery. They secrete oils to protect the skin. Now onto the parenchyma. This is the milk-producing part of the gland. Each duct drains a lobe, and there are about 15 to 20 lobes per breast. These ducts widen into sinuses just under the nipple, where milk collects before it's released. Now let's talk about the stroma, the support system of the gland. The fibrous stroma forms suspensory ligaments, called Cooper's ligaments, that anchor the gland. These ligaments also divide the gland into lobes and keep it in place. Deep to the gland is a loose space, the retromammary space, allowing the breast to move over the chest. Speaking of muscles, the gland rests on the pectoralis major muscle and its fascia. There's also an extension of the gland called the axillary tail of Spence, reaching into the armpit. Let's shift to blood supply. The internal thoracic artery feeds the medial breast. The lateral side gets blood from four main arteries. Let's highlight them. Together, these arteries form a rich vascular network around the breast. Now, how does the nerve supply work? The breast is innervated by intercostal nerves, T2 through T6. The fourth intercostal nerve specifically supplies sensation to the nipple. Let's not forget lymphatics. Most lymph drains into the axillary lymph nodes. The medial part drains into the internal mammary or peristernal lymph nodes. These drainage pathways are super important in understanding breast cancer spread. Clinically, breast is often divided into 4 quadrants for examination and diagnosis. Most breast tumors occur in the upper outer quadrant, near the axilla. The breast changes throughout life, from puberty to pregnancy to menopause. Hormones like estrogen, progesterone, and prolactin shape these changes. So that's the mammary gland, a beautifully complex organ with vital roles in life and health.